Wanna pass the NCLEX? Then let's get started. Today we're going to do a cardiac case study. Mrs. Johnson, a 65-year-old woman with a history of hypertension and hyperlipidemia, presents to the emergency department with complaints of chest pain and shortness of breath. She describes the pain as a crushing sensation in the center of her chest, radiating to her left arm. The pain started about 2 hours ago while she was at rest. Upon further assessment, the nurse notes that Mrs. Johnson is diaphoretic and anxious. Her vital signs are as follows: heart rate of 110 beats per minute, blood pressure 150 over 90, respiratory rate 24, and oxygen saturation 92% on room air. What is the nurse's priority action at this time? Administer nitroglycerin, obtain a 12 lead ECG, administer aspirin, assess lung sounds. Pause the video and select your answer. The correct answer is B. Obtain a 12 lead ECG. Obtaining a 12 lead ECG is the priority action when a patient presents with chest pain and suspected myocardial infarction. It helps in the diagnosing and determining the type of MI, STEMI, or N-STEMI. You can pause the video and go through why the other options were incorrect. The 12 lead ECG reveals ST segment elevation in leads 2, 3, and AVF. What does this finding suggest? N-STEMI, STEMI, unstable angina, pericarditis. Pause the video and select your answer. The correct answer is B. STEMI. ST segment elevation in multiple leads suggests a STEMI, indicating an acute MI. This finding requires immediate intervention such as reperfusion therapy. Pause the video and go through why the other options were incorrect. The healthcare provider orders nitroglycerin for Mrs. Johnson. What teaching should a nurse provide about nitroglycerin administration? Take the nitroglycerin with a full glass of water, swallow the nitroglycerin tablet whole, place the nitroglycerin tablet under the tongue and let it dissolve. Crush the nitroglycerin tablet and mix it with food. Pause the video and select your answer. The correct answer is C. Place the nitroglycerin tablet under the tongue and let it dissolve. Nitroglycerin is typically administered sublingually to achieve rapid absorption. It dilates coronary arteries, improving blood flow to the heart. Pause the video and go through why the other options were incorrect. Why is assessing lung sounds important for Mrs. Johnson? To monitor for signs of heart failure, to assess for the presence of pulmonary embolism, to determine if pneumonia is developing, to evaluate the effectiveness of nitroglycerin. The correct answer is A. To monitor for signs of heart failure. Assessing lung sounds is important to monitor for signs of heart failure, which can occur as a complication of MI. Pause the video and go through the other incorrect options. After administering nitroglycerin, what assessment finding would indicate a positive response to the medication? Increased blood pressure, decreased heart rate, resolution of chest pain, increased respiratory rate. Pause the video and select your answer. The correct answer is C. Resolution of chest pain. A positive response to nitroglycerin includes the relief or resolution of chest pain, indicating improved coronary blood flow. Pause the video and go through the incorrect options. This is part 2 of the case study, which is based on the nurse's notes. Upon admission, Mrs. Johnson received zero point 0.4 mg of sublingual nitroglycerin, and a 12 lead ECG was obtained, revealing ST segment elevation in leads 2, 3, and AVF. The patient's chest pain subsided after nitroglycerin administration. She was started on oxygen therapy at 2 liters per minute via nasal cannula to maintain oxygen saturation above 94%. The healthcare provider has ordered additional medications, including aspirin, clopidogrel, and a beta blocker. Serial ECG monitoring has been initiated. The healthcare provider orders clopidogrel for Mrs. Johnson. What is the primary purpose of administering clopidogrel in this situation? reduce chest pain, prevent platelet aggregation, lower blood pressure, increase coronary blood flow. Pause the video and select your answer. The correct answer is B. Prevent platelet aggregation. Clopidogrel is an antiplatelet medication that helps prevent platelet aggregation, reducing the risk of thrombus formation. This is particularly important in the context of acute coronary syndrome. Pause the video and go through the options that were incorrect. As part of the ongoing assessment, what is a priority for the nurse to monitor in Mrs. Johnson to detect potential complications? Blood glucose levels, liver function tests, renal function, cardiac enzyme levels. Pause the video and select your answer. The correct answer is D, cardiac enzyme levels. Monitoring cardiac enzyme levels, such as troponin, helps assess ongoing myocardial damage and the extent of the infarction. Pause the video and go through the incorrect options. While administering a beta blocker to Mrs. Johnson, the nurse should educate her about the medication's potential side effects. Which statement is correct regarding beta blockers? This medication will increase your heart rate. You may experience bronchodilation with this medication. Notify your healthcare provider if you notice swelling in your ankles. Take this medication with a glass of grapefruit juice. Pause the video and select your answer. The correct answer is C. Notify your healthcare provider if you notice swelling in your ankles. Beta blockers can sometimes cause fluid retention, leading to swelling in the ankles, and patients should be advised to report this to their healthcare provider. Pause the video and go through the incorrect options. When planning Mrs. Johnson's discharge, which information should a nurse prioritize in the teaching plan? Signs and symptoms of heart failure, proper technique for administering subcutaneous heparin, strategies for managing stress at home, recommended dietary modifications for weight loss. Pause the video and select your answer. The correct answer is A. Signs and symptoms of heart failure. Educating the patient about signs and symptoms of heart failure is crucial for early detection and management post MI. Pause the video and go through the incorrect options. The nurse is evaluating the effectiveness of the prescribed interventions. What findings suggest the reperfusion therapy has been successful? Persistent chest pain, ECG showing new ST segment elevation, improved in oxygen saturation, elevated cardiac troponin levels. Pause the video and select your answer. The correct answer is C, improvement in oxygen saturation. Successful reperfusion therapy would lead to improved oxygen delivery into the myocardium, reflected in an improvement in oxygen saturation. Pause the video and go through the incorrect options. Comment below and let us know what is something new you learned. Subscribe and join us next Wednesday.